Hello everyone, welcome to a very new session in pathology. Today we are going to see a very important session, okay? It's a prerequisite for you to learn pathology further. If you want to understand the further chapters in pathology, it is a very basic, okay, like how far you have learned about general anatomy before you go for upper limb, lower limb and all. Similarly, in pathology, it's one of the very fundamentals you should know, okay, so that you can avoid mugging up things later in the future. Fine, yes. And so for that, I'm going to start this session. What is it? Yes, we are going to discuss the various stains we are using in pathology. Various stains we are using in the pathology. And remember, this is the part 1. This is the part 1 of the session. We will have part 2 and part 3 very soon, okay, regarding the stains, various stains we are using in pathology, okay, fine. And let us start without any delay. The first stain is what we call it as hematoxylin and eosin. Yeah? We call it as H and E, hematoxylin and eosin. Remember, it is the most widely used stain in medical diagnosis. You should know the component hematoxylin and eosin. Hematoxylin is the basic stain. It is positively charged. Okay, it will give blue color as you can see in this picture. Okay, you can see various blue color structures here. These are nothing else but what we call it as the nucleus. Am I right? Yes, because not only nucleus, all the basic component will be stained by hematoxylin. And the acidic component will be stained by the eosin, which is nothing else but a negatively charged stain, okay, which will gives you the color as you can show here, seen here, that is nothing else but the orange red. So the nucleus will be stained blue because they are basophilic, cytoplasm are acidophilic, hence they will be stained orange or red. Fine. So yes, here comes a group of stain. This picture and this slide is the summary. Okay, this slide is a VVIP slide. Okay, because this slide is going to give you the whole summary about all the various stains I am going to deal with today. Let us come to this slide again. Okay, again later after the end of this session we will come to this this slide again. Fine. Okay. See the first stain. The first stain is a stain for lipids. Okay. It's a stain for lipids and the name of the stain is called as oil red O. Oil red O. So oil. So red O. That means this stain is going to color the oil or the fat as red color. As you can see in this picture, you can see the red color structures. Am I right? Yes. For fat cells and neutral fats, we will use this stain. And remember, it may be also used in frozen tissue sections. Okay, frozen tissue sections mean we will take the tissue and we will use something what we call it as cryotome. That is, we are storing it under very low temperature of -30 to -95 degrees Celsius. Okay, that is what we call it as cryotome. So that is frozen tissue section. For all those purposes, we will use oil red O, and oil red O will stain the oil or the fat as red in color. Fine. Once that is done, we have another stain for lipid. We have another stain for lipids. Again, this is also a stain for lipid. This is what we call it as Sudan black B. Actually, this is mainly used in fingerprint enhancement. Okay, that is in case of crime investigations and all we will be using. It will be also used for detecting the fats which are contaminated with oil or grease. Okay, and see, as you can see here, the fats are stained black in color. Fats are stained black in color. Okay, the fats are stained black in color. So that is why it is called Sudan black B. See, it will stain the lipids as blue black in color, and the most important significance of the Sudan black B is that it will help in differentiating between myeloblast. You know, myeloblast are the myeloid precursors and lymphoblast are the lymphoid precursors. Remember, the myeloblast will stain positive for Sudan black B, it will stain negative for lymphoblast. This is very important, children, because in hematology, again I will be telling this point, how will you differentiate between myeloblast and lymphoblast. Another, it is an OSPE question. Okay, for your university exam, it is an OSPE question. Name the stain which helps in differentiating myeloblast and lymphoblast. The answer is what we call the Sudan black B. Fine. Once that is done, we have another stain for the lipids. Again, this is a stain for the lipids. Okay, again this is the stain for the lipids, that is called as osmic acid or osmium tetroxide. See, this is used as a stain as well as a fixative. It is used as a fixative in electron microscopy, okay, and it is also used in light microscopy to show fat, myelin, okay. All of this, see, all this will stain black in color. As you can see in this picture, all those will stain black in color. Once this is done, we have another staining, that is what we call as PAS, periodic acid shift staining. This is mainly used to stain the compounds which is rich in carbohydrates. For example, glycogen, glycoproteins, proteoglycans, you know, all these compounds will have very high amount of carbohydrate. You would have learned in biochemistry now. So as you can see in this picture, when I am zooming this, you can see in this picture, see, you have some magenta color. What is the color? What is the color? They are magenta. You can see the magenta colors, okay. These magenta colors are PAS positive material, whereas the nuclei will stain blue in color. So you can see the magenta color PAS positive material. See, the PAS positive materials are magenta color, okay. These are the carbohydrate contents, okay, that stains magenta. Yes, again we have another stain for carbohydrate, especially for glycogen, that is what we call it as the best carmine stain. Best is not the best one, okay, it is the best is name of a scientist. So best carmine stain, it is mainly used to stain the glycogen, okay, and remember it is specific for glycogen, okay. The PAS stain, no, PAS is common for all carbohydrates, okay, it is common for all carbohydrates. And whereas for glycogen, the specific stain is the best carmine stain. Okay, you can see the glycogens are stained red in color. The glycogens are stained red in color. If you zoom the picture, you can well appreciate that. Okay, they are red in color. Fine. So the glycogen are red in color, nuclei are blue in color. Remember, it is specific for glycogen. Okay, yes. We have the next stain. Yes, this is a very common stain and it has been asked in many exams, okay, of your AIMS, PGI, okay, all entrance exams they have asked you. What is this? This is called the Mason-Fontana. Okay, this is Mason-Fontana. This is a stain for melanin. Okay, the stain of choice for melanin. You know, melanin is a skin pigment which gives the skin its color. And remember, the melanin pigment after staining with Mason-Fontana, it will be, you can see the color. It is somewhat brownish black color. Okay, what is the stain color? It will stain the melanin brownish black color, and it is mainly used for diagnosing malignant melanoma. Malignant melanoma, it is a malignant disorder of the skin in which there will be abnormal proliferation of the melanocyte, and in that we can use the Fontana-Mason stain, and you can see abnormal staining of the melanocytes. Okay, Fontana-Mason stain. Then we have called as rhodamine. Okay, what is that? Rhodamine. Rhodamine stain is for copper. Rhodamine is for copper. Okay, it is just for copper. You know, there is a condition called as Wilson's disease. Okay, in Wilson's disease, what there will be excess copper deposition in liver, okay, brain, everybody, in the basal ganglia of the brain and all. So in such a condition, in like Wilson's disease, you can see what there will be reddish brown. Okay, you can see in this picture there will be reddish brown. Okay, reddish brown granular material. Actually, this is what is the name of the stain? It is rhodamine. Okay, this is rhodamine stain for copper. Rhodamine is for copper, reddish brown granular material. Then coming into Alcian blue. Alcian blue. See how bluish? Okay. Yes, the blue is very, what we call it as the sky blue. Am I right? Yes. So actually, Alcian blue stain is for mucin. Mucins are, they are made up of glycoproteins. There is a condition you will study in GI pathology, that Barrett's esophagus. Already you will have come across this word. It is a It's a metaplasia, squamous metaplasia of the lower esophageal junction. Am I right? Yes. So what will happen in such a case? What the Alcian blue staining will show? Okay, usually the esophagus do not have goblet cells. Goblet cells is not present in the esophagus, but as a result of this metaplasia, because of this Barrett's esophagus condition, what will happen? There will be presence of goblet cells, which inside, goblet cells is filled with the mucus or the mucin, which are glycoproteins, and they will stain positive with the Alcian blue stain. Okay, yes, see, the mucins are stained blue. That is why it is called as Alcian blue stain. See, Alcian blue stain is the stain of choice in case of Barrett's esophagus. Barrett's esophagus, again in Barrett's esophagus, I will tell you, in Barrett's esophagus, it is the stain of choice. Okay, Alcian blue. Fine, I hope it is clear for you. It's the stain of choice. Then we have, this is called as modified Faucher's. Yes, Faucher's test you have done for bile pigments. Yes, of course. Here also the bile pigments will appear yellow, blue, in brown on hematoxylin eosin. See, remember, even in our normal hematoxylin eosin staining, the bile pigments can be seen. See, in normal hematoxylin eosin stain, bile pigments will stain yellow brown in color. What is the stain? It will stain yellow brown in color. But whereas we have a more specific stain. For example, I have told we have patch stain for all compounds which are carbohydrate. Then I told you that the most specific stain for glycogen is best carmine. Similarly, we can stain the bile pigments will also looks like yellowish brown in normal HNT staining. But remember, there is a specific stain for the bile pigment that is called as Faucher's staining. Okay, in this Faucher's staining, what will happen? Yes, as you can see here, the bile will looks like an emerald blue-green color. Okay, this is an emerald blue-green color. You should not know the principle and that. Okay, if you need, just go through this. Actually, the pigment will get converted into biliverdin, and which will combine with the ferric chloride and so to get this color. So just forget out that. Okay, just remember it in modified Faucher's stain we will get emerald blue-green color. Fine. Then we have calcium. Calcium, we have two stains. One is called as von Koza, which is a non-specific stain, and we have another one is called as alizarin red. These are the two stains for calcium. Again, both are your OSPI questions. Okay. Von Koza stain is for calcium, and it is used in the calcium deposits. Okay, in the frozen section. And as you can see in this picture, what is the color? The calcium will looks like black. See, the calcium will look like black. Okay, so the calcium will looks like black. What another black I have told you? Sudan black. That is for lipids. Okay, yes. Remember, von Koza is non-specific. We have a most specific the stain for calcium, that is called alizarin red. As the name indicate, alizarin red, the calcium will looks which color? Red in color. Okay, yes. Then we have a very important stain that is called as Pearl's Prussian blue stain. It's a VVIP. It's a very, very important stain. This is the stain for hemosiderin or iron compounds. So I told you rhodamine is for copper. Okay, for iron. Okay, for ferrous compounds, for iron and hemosiderin, we have Pearl's Prussian blue stain. The Pearl's Prussian blue stain will stain the ferric things as what? Blue color. There is a condition, we call it as hemosiderosis. Okay, hemosiderosis. Okay, primary, secondary, we have a lot of hemosiderosis and all. Okay, and in such conditions and all, what will happen? There will be increased iron deposits in liver and all, which can be stained by Pearl's Prussian blue stain. Pearl's Prussian blue stain is a stain for hemosiderin. It is a stain for iron. So actually, what is happening? If there is any ferric iron present in the tissue, which will combine with a ferrocyanide, which is present in the reagent, to get a bright blue pigment called as Prussian blue or ferric ferrocyanide. Okay, ferric plus ferrocyanide gives ferric ferrocyanide, that is the Pearl's Prussian blue. So the ferric iron will give blue color. Okay, yes, we have another one more stain that is called as Hale's colloidal iron. What is that? Hale's colloidal iron. Actually, even though the name indicates that what it's Hale colloidal iron, actually it has nothing to do with iron. Actually, here what is happening, there is a condition called as chromophobe renal cell carcinoma. In renal cell carcinoma, we have lot of variants. Out of that, we have clear cell variant. Out of that, one variant is called as chromophobe variant. In the chromophobe variant, the acid mucins or the acid mucopolysaccharide, I told you, Alcian blue is for mucins, but for acid mucopolysaccharide we have a much more stain, okay, specific stain that is called as Hale's colloidal iron. So remember, the question here is Hale's colloidal iron. It is a stain not for iron. Okay, it is not for iron. It is a stain for acid mucopolysaccharide. For acid mucopolysaccharides. Okay, here comes an MCQ question. Which of the following is not a stain for iron? The answer is Hale colloidal iron. Okay, see, these are the questions how the examiners will frame in your PG entrance exams. Okay, Hale's colloidal iron, it's not a stain for iron because it is going to stain acid mucopolysaccharide, and in case of chromophobe type of renal cell carcinoma. We have another stain, children, that is called as Grimelius stain. What is the name of the stain? Called Grimelius. Okay, we have lot of neuroendocrine tumors, as we have learned in biochemistry, carcinoid syndrome. Okay, that is 5-hydroxyindolacetic acid. Am I right? More compounds are produced now. So in such cases, in order to detect such neuroendocrine compounds which are present within the secretory granules, we use the Grimelius stain. This will give the argyrophilic. Argyrophilic materials means what? They have something that they are derivatives of silver salts. Fine. They will stain dark or black in color and the background will be yellow. You can see, you can see in this picture. You can see in this picture. Okay, dark or black in color. Okay, dark or black in color with background you can see as yellow. Okay, background you can see as yellow. This is called as gramineous stain. Okay, yes. So this is the book I refer, Histological and Chemical Methods, Histochemical Methods by J. Kirkman. Okay, there is no need that you should go and read this book. You should know what I have just mentioned. Okay, you can answer any type of questions from this. Okay, number 1, normal staining is hematoxyl neosilin. Okay, let us go for this. This is the final stain. Okay, this is the slide for take home message. Take home message slide is this. Okay, what are the stains? Fat, oil, red O. Name itself indicates fat will be red in color. Sudan black B. Name itself telling the fat will be black in color and it is helping to differentiate myeloblast from lymphoblast. Out of that, which is going to positive for the Sudan black? Myeloblast. Good. Okay, osmium tetroxide, it is a stain as well as a fixative in electron microscopy. Again, here the fat is black. Glycogen, we have PAS staining, but what is the most specific staining? Best carmine staining. Calcium, we have 2 staining, von Cosa, alizarin red, which is most specific, alizarin red. Here calcium will stain black in von Cosa. In alizarin red, calcium will be red in color. Good. Iron, what is it? Pearl's Prussian blue. What is that compound? Ferric ferrocyanate. Copper, it is rhodamine. Of course, we have another one more stain called as arsine. Okay, arsine. Okay, arsine and rhodamine. Fine. For example, they will ask in Wilson's disease, which of the following stain you will use? Answer is yes. Answer is rhodamine. Good. In hemosiderosis, which of the hemochromatosis? Okay, yeah, hemochromatosis, hemosiderosis, and all those conditions. Which stain you will use? Pearl's Prussian blue stain. Finish. Okay. Then we have what? Melanin, Fontana Mason, and there is another one more stain called as what? It's called as you can spell like it's called the SCH is silent. Moral stain. Okay, how will you SCHMORLS? Okay, this is moral staining. Moral staining. The CH part is silent. Moral staining. Remember, moral staining is also for melanin. So, which of the following stains can be used to stain melanin? In case of multiple option type questions, you can go for both options. Fontana Mason, which is the most commonly most specific staining, and moral staining. And for copper, 2 stain, rhodamine and arsine. Then bile. Modified forceps, what is their color? Emerald green color. How it looks like in normal hematoxyl neosilin staining? Yes, yellow brown. Super. What is acid mucopolysaccharide? Hales colloidal iron stain. Remember, it has nothing to do with iron. Hales colloidal iron stain is not used to stain iron. It is used to stain acid mucopolysaccharides in chromophobe variant of renal cell carcinoma. Don't worry the name. When it comes to the renal pathology, we will see what is a chromophobe cell variant, all those steps. Fine. I hope things are very clear for you. Yes. So that finishes a very important part, stains in pathology part 1. Okay, we have seen all stain, Pearl's Prussian blue. Out of that, let me see some of the common questions. Number 1 is what we call it as a Pearl's Prussian blue. Number 2 is what rhodamine. Okay, the rhodamine stain can be asked. Then number 3 is the normal hematoxyl neosilin, that is the most commonly used stain, and PAS staining. These are the very commonly. Okay, very commonly. And remember, for calcium, von Cosa and alizarin. So these are some of the 4 to 5 stains you must know without any fail. Okay, and remember morals and Fontana Mason is for melanin, rhodamine and arsine is for copper. So I think with that we can finish this session. Thank you very much for listening this session. We will continue the stains in pathology part 2 in a very another session. Thank you.